Hi, so today we're going to be talking about gas gangrene. It is positively deadly. Now, gas gangrene is caused by a bacteria called Clostridium perfringens. This bacteria is an obligate anaerobe, meaning it does not require oxygen to survive. It lacks the enzyme catalase. Therefore, oxygen is toxic to it. When it comes in contact to oxygen, spores are released, which, under the right conditions, will become fully formed C. perfringens. Now, these spores are resilient and extremely resilient to heat and cooking in certain times. Now, let's look at the pathogenesis of this. C. perfringens is an opportunistic infection. It's fast spreading. In the matter of hours, it can multiply exponentially. It's highly lethal if left untreated. Usually, it enters the host through cuts or abrasions. Now, C. perfringens is a natural or is part of our normal flora in our gastrointestinal tract. It is also found in the soil. So, if you come in contact with, say, a farming tool that has been used in soil that is rich with C. perfringens, and you get a cut with that equipment, you can become infected with this disease, with this bacteria, which would cause clostridial monocrosis or gas gangrene. Now, there are many virulence factors we can talk about. We can talk about the kappa toxin, but what we're going to focus on right now is the alpha toxin, or CPAT. Now, when this alpha toxin is released into host cells, it causes damage to them, causing them to lyse or pop. The result is rapid, massive destruction of muscular and soft tissues. As you can see here in this photo, there is a lot of tissue destruction right there. Now, let's look at some symptoms from minor to severe. Now, some minor symptoms could be blisters forming on your skin, jaundice, which is just the yellowing of skin, vesicle formation, which is slightly more severe. That's multiple blisters coming together and forming vesicles. Now, some more severe symptoms could be painful swelling, which subcutaneous emphysema. Now, that's when air or gas, oxygen, gets underneath your skin and bubbles up. This can cause that crackling or popping sound, which is associated with gas gangrene, and it's essentially is crepitus. Now, another symptom is increased heart rate or tachycardia. Now, this can have negative effects on your cardiovascular system, your heart, and be extremely negative towards that. Another impact of this could be fever, ranging from medium to high fevers, due to infection and your immune system trying to fight off this bacteria. Now, let's look at some treatments and cures. Now, there are no current vaccines for C. perfringens in the gas gangrene section. Mostly what's used is surgery and antibiotics. Surgery, its purpose is to clean the wounds thoroughly and get any dead tissue or remaining foreign objects out of the wound. Now, surgery is generally paired with antibiotics, but we'll get to that in a second. Surgery, the purpose, like we had said, to remove this, sometimes it doesn't work if it's too far onset, and they must result to amputation of a limb, an appendage, or just massive grafts of skin. And therefore, they would have to use a prosthetic or additional skin grafts from others to try and, fill that site. The antibiotics that are paired with surgery usually fight off, clear out the infection and prevent it from reoccurring. Penicillin and clindamycin are typical antibiotics that are used. Now, these can be given through the vein or orally. Many of these treatments are effective and are used today. Thank you for your time, and I hope you have a great rest of the day.